is suspension of classes by the different local government units and also the suspension of different mass gatherings.
The transition experience of newly graduated nurses has been significantly impacted by changes to the educational process and the healthcare system structure brought about by the COVID-19 pandemic. New graduate nurses with 2 years of experience in an actual face-to-face teaching and learning modality during their first and second year in the program suddenly switched to an online setup, and now will be exposed to the actual clinical setting as professional nurses. With this, nursing curricula are challenged in providing quality education because of the sudden shift to online education due to the COVID-19 pandemic. This leaves us in question. Are newly graduated nurses prepared and ready to embark on a new chapter of their journey as nurses amidst the challenges they faced? A pleasant day to all. We are from BSN 3C Group 2A. I am Louise, Dianne, Elarmo, and together with me are Kyla, Francine, Cepriano, Sofia, Cuaresma, and Maria, Elisa, Gale, Doria. We present to you a research paper entitled Level of Preparedness of Newly Graduated Nurses in the Clinical Setting. At present, nursing curricula are challenged in providing quality education because of the sudden shift to online education due to the COVID-19 pandemic. The purpose of the study is to collect responses from newly graduated nurses in order to detect gaps in novice practice preparedness.
Now, for the objectives of the study aimed to determine the perceived level of preparedness of newly graduated nurses in the clinical setting. Specifically, the study sought to answer the following questions. What is the profile of the newly graduated nurses according to sex and area of assignment interested in? Next, what is the level of preparedness of newly graduated nurses to practice in the clinical setting according to clinical knowledge, technical skills, critical thinking, communication, professionalism, and management of responsibilities? And lastly, is there a significant relationship between the overall level of preparedness of newly graduated nurses and profile variables such as sex and area of assignment interested in?
Moving on to the methodology for the research design, a descriptive quantitative was utilized. It will assess the relationship between the participants' demographic profiles and competencies to the level of preparedness of newly graduated nurses to practice in the clinical setting.
For the participants of the study, we have the batch 2022 newly graduated nurses employed in any of the healthcare institutions in Bacolod City, bearers of a professional nurse license. 18 newly graduated nurses were the recommended sample size.
Moving on for the instrument, a standardized questionnaire, the new graduate nurse performance survey was utilized. It is divided into two parts. The part one is the participant's demographic profile, and the part two is the level of preparedness among newly graduated nurses for actual clinical setting. For the consistency and reliability of the instrument, a Cronbach alpha was used and derived a score of 0.986 with an internal consistency of excellent.
Moving on to the result and discussion. For the table 1, out of 80 participants, 83.8% of them are female while the remaining 16.3% are males. Nearly half of the participants were interested in the medical or surgical field, whereas just roughly a quarter of the participants were interested in critical care or emergency departments. The number for individuals who desire to work in women's or children's health as well as other hospital departments are nearly equal, coming in at 17.5% and 16.3% respectively.
Now for Table 2. As a whole, the average mean score, which is 5.26 with an SD of 0.56, is interpreted as somewhat prepared in the 6 competency areas presented. This indicates that new graduated nurses may lack confidence in conducting patient assessments effectively, recognizing changes in patient status, prioritizing tasks, and managing responsibilities. Inadequate guidance during orientation and unrealistic expectations from certain ward personnel may contribute to this. The transition to practice is a critical learning phase for new nurses to become experts in the field.
Moving on for the table 3, there is no significant relationship between the level of preparedness and the variable sex, which is 4.162, with having a p-value of 0.203, and the area of assignment interested in, which is 8.375, with having a p-value of 0.497. Therefore, the null hypothesis is not rejected at 5% level of significance. It also shows that independent variables are not an indicator of their level of preparedness as a whole.
For the conclusion, overall, despite the gap between the educational ideal and practical reality, the level of preparedness of newly graduated nurses is somewhat prepared. In order to meet the increasing clinical care needs of patients, newly graduated nurses continue to need greater levels of support. There's little information available regarding how expectations and transitioning experiences during the first year of practice are affected by changes in new graduate nurses' satisfaction with clinical supervision and the practice environment.
Now for the recommendations. For hospital administrators, they can consider developing policies and programs to support newly graduated nurses. For nurse educators, they can develop and incorporate new teaching strategies into their lectures and clinical teaching methods. For nursing students, they can seek feedback and guidance to improve skills and insight. For newly graduated nurses, they can identify the possible variables that may affect their readiness in a practice setting. And lastly, for future researchers, they can include profile variables such as participants' length of experience to provide a more comprehensive understanding of the factors influencing the level of preparedness of newly graduated nurses.
For our references, we have provided a QR code at the lower right corner of our poster. To access, kindly scan and it will direct you to our list of references. This ends our presentation. Thank you so much for listening and have a great day ahead.